All right, we got some ABGs. Asian baby girls. No, just kidding. It's time for some Naplex questions. So, questions ask, an elderly female is admitted to the hospital after falling down the stairs. She hits her head as in the ICU. An ABG is obtained and the results are as follows. 7.92, 28, 96, 26, 96. What acid-base disorder does this patient have? So you have to memorize this notation here. I actually rarely see 5 numbers. I usually see the first 4 numbers, but these correspond to pH slash pressure of carbon dioxide, pressure of oxygen, bicarbonate, and O2 saturation. The only important numbers are the pH, the carbon dioxide, and bicarbonate. These are the only 3 you need to know. The other 2, the oxygen, I'll just ignore those. So you can memorize a table to easily answer this question, but sometimes it's hard to remember the table. But here's what the table would look like. So the pH and the oxygen and the bicarb. So in metabolic acidosis, you have low pH, low carbon dioxide. Oh shoot, this should be carbon dioxide. Low carbon dioxide and low bicarbonate. And metabolic alkalosis, you have high pH, high carbon dioxide, and high bicarb. For respiratory acidosis, you have low pH, high carbon dioxide, high bicarb. Respiratory alkalosis, you have high pH, low carbon dioxide, and low bicarb. And you should memorize the normal values or the ranges for pH, carbon dioxide, and bicarb. So pH, the normal is 7.4. Carbon dioxide is between 35 and 45. And bicarb is 22 to 26. So I'm going to show you my method. If you have trouble memorizing this table, I'm just going to show you my method of how to answer this question. So first, determine if acidosis or alkalosis. So in order to do that, all you have to do is look at pH. That's the only thing you look at to determine if it's acidosis or alkalosis. So if the pH is low, that equals acidosis. If the pH is high, that equals alkalosis. And then so next, determine if metabolic versus respiratory. Right? So when I see carbon dioxide, I usually think that it's acidic and respiratory. And then I ask myself, does the pH follow carbon dioxide correctly? If yes, then it's respiratory. If no, then it's metabolic. So in this question, so the pH is 7.92. So that means it's high pH, right? And the carbon dioxide is 28, which is lower than this normal range here. So the carbon dioxide is low. 28 is low number. So I already know here that it follows this. Respiratory alkalosis, I know that's my answer already. And the bicarb is about normal. So you can ignore bicarb. You only want to know the ones that show a big significant difference. And on the actual Naplex, you're going to have easy numbers like this. You're not going to get like a really close number like 34 for the carbon dioxide and like 21 for the bicarb. You're going to get like really different numbers than the normal range to make it easy. So that's if you memorize the table how to answer it. That's D. The answer is D, respiratory alkalosis. But if you want to use my method, if you have trouble memorizing this table, so I determined first if it's acidosis or alkalosis based on the pH, 7.92. So since it's higher than normal, I already know for a fact that it's alkalosis. And so next, now that I know it's alkalosis, I got to determine if it's metabolic or respiratory. So it's alkalosis, so the pH is high. And in order to determine if it's a respiratory versus metabolic, I look at CO2. So alkalosis has a high pH. CO2 should have a low pH, right? So if it's a low pH, because CO2 I consider acidic, but then it's not, our problem is that's respiratory. I mean, it's alkalosis. So alkalosis should have a lower pH, carbon dioxide, which is true. So that's why I know it's respiratory versus metabolic. And it's easy to remember because CO2 is something you breathe out. So it should be respiratory, right? Because you breathe out carbon dioxide and it's acidic, like carboxyl acid. That's what I do. So if you have any questions, please leave it in the comments. Thank you.